Thank you for joining me and Melanie and our guests for today in this wonderful chat that we always look forward to be having. So I'm going to turn you off to Melanie to lead us on today's chat.
Thanks so much, Kaboni. So this is our second GAIA Nurses Corner. And Kaboni and I are both board members for GAIA, very proud board members. Kaboni, I'll let you introduce yourself a little bit, but I'm a pediatric nurse practitioner. I'm also a proud GAIA supporter, and I've worked with GAIA in the past. And today we're going to be talking about the global nursing shortage, and particularly how it's affected Malawi and what programs GAIA has done to tackle the nursing shortage. So I will let you, Kaboni, tell the audience a little bit about yourself before I introduce our guest of honor, Joyce Jere.
Okay, thank you. So my name is Kaboni Gondwe, and as Melanie said, I am one of the board members for GAIA here in the US. And another interesting thing about me is I'm also the first GAIA Nursing Scholar. So this discussion today is very dear to my heart, and it's something that I'm excited to talk about on the nurses in Malawi. I'm originally from Malawi. I did my nursing in Malawi, and I started off my career as a nurse in Malawi.
Thanks, Kaboni. And Joyce, can you hear me okay?
Yes, Melanie, I can hear you very well.
Okay, good. Thank you for joining us. So I get the great honor and pleasure of introducing everyone to Joyce Jere. And there's probably some people out there listening that already know you, but you are the country director for GAIA currently, but you're a nurse midwife with many, over 20 years of experience at all levels of nursing. So from the bedside nurse midwife working in the hospitals, to leading programs, to training nurses. And now you lead I think a staff of over 100 Malawian nurses. Am I correct, Joyce?
Yes, yes.
Yeah.
You are correct.
So you lead a whole Malawian staff that is providing important care on the ground to supporting orphans and vulnerable people. And I think that your training as a nurse midwife has really strengthened what we do in Malawi, what GAIA does in Malawi. And today we're going to be talking about the nursing shortage, but I just wanted to introduce you and welcome you and thank you for joining us. I understand it's the end of a long day there in Malawi.
Thank you very much, Melanie. I'm happy to be part of the this Nurses Corner today.
Thanks so much, Joyce. So let's get right into it. We're not going to have a lot of time today to talk, but we wanted to just talk a little bit about something that I think all of us are acutely aware of, is especially through this pandemic, is the shortage of nurses throughout the world. In 2020, right at the beginning of the pandemic, the WHO director, the head of the WHO at the time, Dr. Tedros Adhanom Ghebreyesus, quoted that nurses are the backbone of any healthcare system. And today, many nurses find themselves at the front line of the battle against COVID-19. I think nurses have been on the front line of every epidemic and a lot of the public health challenges that we face. In 2020, the WHO and the International Council of Nurses also published a report with numbers about the nursing shortage and said that we have a shortfall of 5.9 million nurses, with the greatest gaps in Africa, Southeast Asia, and Eastern Mediterranean region. And I read this report a little bit and I was so shocked because it revealed that 80% of the world's nurses work in countries that are home to half of the population. And so I know we know the numbers, and as nurses, we feel it every day with the workload. I think the burnout has been real for all nurses. But I wanted you to talk a little bit about what that looks like in Malawi. We know a stat that 62% of the nursing positions in Malawi, particularly in the government or public sector, are vacant. So I just wanted to ask you, Joyce, like, what does that look like on the ground in Malawi, that type of nursing and midwife shortage?
Thank you, Melanie, for that question. Malawi, first of all, I have to tell you, the audience, about the population of Malawi. Malawi has over 17 million people, and 80% of the people in Malawi live in rural areas, and they depend on the public health care services. And if you talk about the shortage of nurses, it's mainly felt in these rural areas where a lot of people live there. Our communities are denied of the care, the primary health care services, because in these areas, although you have said the vacancy rate is 62% countrywide, but in the rural areas, it's below that, especially in the nurse midwife technicians. We have two cadres of nurses, the nurse midwife technicians and the registered nurses. So the nurse midwife technicians are mainly deployed in the rural areas, and the vacancy rate is below the 62%. Which means our population are denied of access to quality healthcare services. They die sometimes due to conditions which could have been prevented. So that's how much we are affected in terms of nursing shortages in Malawi. The great impact is in the rural areas.
Yeah, and it's interesting that you said the majority of the population in Malawi live in rural areas, and that's where the greatest need is. One thing you mentioned nurse midwife technician, which is one type of nurse in Malawi, and you mentioned registered nurse midwife, which is another type of nurse in Malawi. And both have midwifery training, is that right? Nurses in Malawi work as midwives, so delivering care to pregnant mothers, and as well in hospitals and clinics, is that right?
Yes, over 90% of the nurses in Malawi also train in midwifery because they are required to provide the midwifery care wherever they are. So you cannot actually separate the two because of this great shortage of nurses and midwives. So they have to have those skills of nursing and also the skills of midwifery.
And maybe just to kind of, having worked myself in Malawi as both a nurse and midwife and as a nurse educator as well in Malawi, I can agree with Joyce that, nurses are the backbone of our healthcare system. And especially in the rural communities, we have health centers where they are manning all of the patients from different conditions. I mean, they're pretty much specialized in everything that they're doing. And they're providing care to a large number of people. I mean, it's not like they only have 20 people to see. No, they have that whole catchment area, and there could be only one nurse midwife there or two nurse midwives there. So they are really the backbone of the healthcare system, and they save lives in those rural communities.
Yeah, and there are times when only one nurse midwife manages the whole health center. So she has to see all the emergencies, and at the same time also go to the maternity unit and conduct deliveries. And sometimes for 2 or 3 days without having a day off.
Wow. Wow.
So there's this stretch of being overwhelmed physically, emotionally, and then their social life is also taken away because they do need a day off so they can go back to their families and friends. So, I mean, I really say I appreciate our nurses and all the sacrifices they are making because it really takes that whole toll. I mean, health is important to them and they need to be healthy too.
Yeah.
You know, one thing when I was, I spent some time in Malawi, and one thing I noticed, I'm not a midwife, and I'm trained in pediatrics. But what I noticed was oftentimes I found myself, and I was training nurses, I found myself in pediatric wards without clinical officers or physicians. Clinical officers, for the audience, are similar in the United States to physician assistants or nurse practitioners. And so oftentimes the nurses there are really managing the care. So they're diagnosing and treating patients. We got an interesting question in the chat group from one of the audience members. And I just want to, Joyce, just read it to you because it does highlight, the question is, they wanted to understand the role nurses play in healthcare in Malawi versus doctors. I know there are way fewer doctors than one might imagine, but please address the number of nurses versus the number of doctors and what that means and who is actually delivering healthcare. How much more of a burden is this for nurses versus the role in which they were trained for?
Thank you very much, and thanks to that question. I would give an example of a rural district hospital. Most of our rural district hospitals have 2 doctors, the whole hospital, serving a population of maybe 4,000 people, maybe sometimes 5,000 people in the district. So because there are only 2 doctors, one doctor is the one that supervises and does the administration for the hospital, and the other doctor is the one that comes in and sees difficult conditions and also conducts cesarean section. So what it means is most of the work in the hospital is done by nurses. The nurses operate the family planning clinics, they do antenatal care clinic, they do under 5 clinic, and when they're in the wards, they are the first people to see the patients. If it is in a pediatric ward, they are the first staff to see the children and their mothers. And then they provide the first care. They do take all the history and provide care before the doctor comes. Because sometimes it takes the whole day without having seen a doctor or a clinical officer because they are overwhelmed with a lot of patients. So a nurse does a lot of work in our setting. It goes to even putting up an IV line, nasogastric tube, preparing patients for theater, taking care of the patients after theater, and even helping in the theater as well. So a nurse in Malawi is like everywhere and has to gain the skills to be everywhere. Yes. Yeah. I hope I have addressed that question.
Yeah. Yes. Yeah, you have. And I think this brings us, I know Kaboni has another question for you, but I wanted to say that, you know, one thing I've learned from a lot of the nurse midwife colleagues that I've worked with is that there's so much on-the-job training that happens. And even in nursing schools, nurses in training are really filling a big gap when they're on the wards getting trained. Even though they're still in training, they do a lot of patient care.
Mm-hmm. Yes, that's very true. And I mean, I just wanted to echo some of the thoughts that Joyce said. Was, I mean, when you think about it from the US perspective, is our nurse technicians and our registered nurses are actually working as nurse practitioners. Mm-hmm. They are taking roles of nurse practitioners, and they have to also be a general nurse at the same time. They don't have anybody else to take the other tasks so that they can focus on routine care. So, I mean, this is something that I must say. I mean, I've been a nurse educator for a while. And I mean, and I know that this overwhelming thing that we do to them, we do need to find a solution for it. Mm-hmm. Mm-hmm. We do need to figure out a solution that could alleviate the burden that they have right now. And I know that GAIA Global Health has been taking a role for both infrastructure and also human development, resource development in the country. So Joyce, the question that I had for you was, can you explain, I really wanted to come from you, can you explain more about the work that GAIA Global Health has been doing for the last 20 years to increase the number of nurses in the country?
Thank you very much, Kaboni, for that question. GAIA Global Health has been very helpful in terms of sponsoring education for our nurses and midwives in Malawi. For over 20 years now, over 600 nurses have been sponsored. And the sponsorship is very unique. The sponsorship that we provide includes tuition, stipends, and even psychosocial care. We even go to follow up the student once the student has been enrolled, even in their homes if they have their problems. So we even provide psychosocial support. So it's a very unique scholarship. And because of that, and really people or students, they really I wish I would have received a scholarship from GAIA. All the time they would say, even the colleges, when they are enrolling their students, when they find very needy students, they give those students to say these students are going to be GAIA scholars. And another unique thing is that it contributes to increasing a number of nurses in the country, because after graduating, the nurses serve the public sector. And they serve the public sector in those rural areas which I mentioned before. So that's unique about this scholarship. And as I talk now, 93% of those nurses who graduated are still working in public sector, filling in the gaps.
Yeah. And one thing that I'm so proud of our GAIA Scholar alumni is their dedication to the communities that they serve. And I mean, and I really wanted you to kind of speak more on the agreement that they work in the public health sector, because that is really something that I want people to know, that they are committed to serving that rural population that we have. And another thing I know that I really wanted you to talk a little bit about was the quality improvement projects that they do, if you can.
Oh, okay. Thank you, Kaboni. Our nurses, when they graduate, indeed, most of the nurses, when they graduate, they refuse to go to the rural areas, but GAIA alumni are so special. They feel like the rural areas is where they can go and provide the services that are needed there. So when they go there, they have challenges as well. All is not well, because they need to improve their care in those facilities. So these alumni, they meet with the heads of departments, the head of the institution, and propose a project to improve quality of care in these facilities. So they have a lot of projects, and these projects for improving quality of care started when Melanie was working in Malawi. And we started like we were just saying, how can we help these scholars improve quality of care? And out of that, as I'm speaking now, we have improved the kangaroo mother care ward in Mlambe. And at the moment, we are working with Insanje District Hospital in the southern region and Trinity in cervical cancer screening. So the alumni are doing a great job, not only about the quality improvement, but they also are passionate about the other students that are also failing to pay their own school fees. And they contribute and pay school fees for someone who is also in financial need.
And I know Melanie does have a question too, but one other thing that I just wanted you to speak to, you mentioned about the psychosocial care that you provide to the scholars. So, and I just wanted you to speak a little bit about that too, because you do support the scholars that are in training, and then you continue to support and collaborate with the alumni that are outside. So I just wanted you to highlight that so that people can know what you're doing.
Okay, so about this follow-up and psychosocial support, what we do is that, you know, some other sponsorship, when a student fails, that's the end of the sponsorship. But GAIA looks at that student to say, why did this student fail? Most of the students are from the background, which is very, very poor. And they have multiple roles. They are from child-headed families. So apart from being at school, they have also to take care of their other siblings. So if the students are failing, we have one-on-one discussion to say, what is it that is a problem that is bothering you? You find out that probably their parents are sick at home. Maybe they would like to withdraw for 1 year and take care of someone who is sick at home. So we start counseling them, we provide, we connect them, we link them to somebody who can be counseling them within the college or maybe outside the college. There has been time when probably some other students have really gone into mental breakdown, and we have followed them in their communities, and then we have counseled the caregivers on how they could support them to go back to school. And some have come back to school and are now working in good health. So that's the part of psychosocial support we provide.
Thank you so much for that. And I understand, I really like that piece of looking at the student as a whole and not just focusing at the grades, but understanding that they're human beings. They can struggle, that it's okay. They fail, which is sad, but there's an opportunity to grow from that failure and be excellent. I mean, they are excellent nurses, excellent student nurses, excellent alumni, and I must say I'm very proud of them. Okay, Melanie.
I agree, Kaboni. I think that I've had the privilege of meeting a lot of the GAIA Nursing Scholars, and it really feels like a family. And you know, the GAIA staff who help, because it is a very rigorous process to get the scholarship, but the GAIA staff that work with our GAIA Nursing Scholars keep in very good touch with them constantly and get them together. So it really does feel like you're not alone, or that's what I imagine. Yes. I hope that that's how they feel. You know, Joyce and I have worked on the GAIA Scholarship Program together, but I wanted you to share kind of the lessons you've learned as you've implemented this this program? I know there's been challenges, but what lessons have you learned?
What mainly I have learned from this scholarship, as I already said, is that it's a special scholarship. And it's unique. We don't work in isolation. We partner with the colleges, and we also partner with the Ministry of Health to see these students graduate. That's so special that I have learned. It's not like a scholarship which we provide and we just GAIA there, but it's done in partnership with the mother body Ministry of Health and also the college. However, there have been challenges. Of late, the students take long to graduate, from the time they graduate to the time that they are deployed. But as I said before, we take care of our graduates. So at the moment, we have a grant from USAID, which is helping us bridge the gap from the time they graduate to the time they get deployed. So at the moment, we have currently deployed over 90 nurses, not only GAIA scholars, but also the nurses in the country that have graduated and are waiting to be deployed. And we are doing this with funding from USAID. So, as I said, GAIA really takes care of the scholars in a special way. So that's one of the things that we do. We look at the problems, and the problems become an opportunity to say, okay, if there is a delay, what else can we do? Can we find money to help bridge this gap? So that's so special about this program.
Yeah. And can you tell us, Joyce, how many GAIA scholarships have been awarded since it started back in 2001?
Yeah, we have provided over 600 scholarships now.
Wow, wow.
And at the moment, we have 127 in school at the Kamuzu University of Health Sciences. And we have 90 in other colleges which are training nurse-midwife technicians. And another special thing is that we don't only sponsor when they're in first year, but we take them from first year until they complete.
Yeah.
We take care of their also their licensure exam fees and even preparation for the licensure exam. As a result, we have found that 100% of our students, our beneficiaries, pass the licensure exams, ready to go and save the communities.
Yeah, that's nice. Okay, so I have the next question. So is there one, so the question that I have is I wanted you to share one story about one scholar that stands out in your mind that you think you can share with our audience today.
Kaboni, there are so many, but I'll just talk about one, since you have asked me about one.
Yes.
And this is a recent one whereby we were giving scholarships at one of the colleges. During the inauguration, one scholar cried, and the whole gathering was emotional. She cried because she couldn't believe that she has been saved from the challenges that she had. This scholar lost parents when she was young, and it has been her dream to become a nurse. So when she was in first year, she went there and dropped out of school. And she was kept on reserve. She dropped out because somebody who promised to sponsor her lost a job. So nobody could sponsor her education. So her name was put on the reserve. And when the college learned that we are going to sponsor the college, the students in that college, they called her back and then was awarded this scholarship.
Wow.
So that day, it was like, it was very emotional. Very, very emotional. So you can see how our scholarship changed somebody's lives.
Yeah. And I know I have heard so many of these success stories from the time that I graduated and I started teaching at Kamuzu College of Nursing. I saw all these touching stories. It's been a very challenging time, not just for nursing scholars, but just in general. Education the cost has increased. And not only tuition, they have to look at their living expenses as well. So having these opportunities to fund these students really alleviates their stress, helps them to focus on their education. And I want to appreciate all our donors that do that for these students, because they're not only saving that person, they're saving their family and their future generations that are to come.
Yes.
Yeah,
it's true.
I think about how for so many nursing is a calling, and for that young woman, you know, she's able to live into her calling and how many lives she'll go on to save.
Yes.
Yeah. So actually this is Joyce, a question that I wanted to ask, because I feel like you have just so much wisdom and we can learn from you. So my question is for nurses who are just starting out their careers, or even some of the young people that are studying nursing now, or young people who are considering nursing, what advice do you have for them?
A good question, Melanie. I can talk about the advice like the whole day, but in the interest of time, what I can tell these nurses who want to join somebody who is coming into the profession for the first time is that nursing is a calling. And nursing is a profession which brings you very close to somebody who really needs help. So we say a friend in need is a friend indeed. So a nurse becomes a friend indeed when a patient is ill, when a woman is having a baby, when a woman brings a baby at the hospital, when a man is in pain, when somebody is injured, when somebody cannot gain their body, a nurse comes in against their body. When they cannot bath themselves, a nurse comes in there. When there is nobody, not even a relative on the bedside, the one on the bedside is a nurse. So nursing is a profession which requires passion. It requires somebody to be cool and courageous. And you just enjoy every moment you have there. Talk to your patients. Learn what they want. Sometimes they can't talk, but they'll give you signs that they want a cup of water. They can give you signs that they are in pain, and you go close to them. And then when you provide what they want, even when they're not speaking, you find that they will be smiling. So I have found this profession as a very, very noble profession. And I enjoy being a nurse. And don't be surprised when I go to bedside nursing when I retire. So that's the advice I can give to somebody joining. Yes, to be ready to be a friend to somebody who is suffering.
Thank you.
Yes.
That reminds me, when the first day I went into nursing school at KCN, I remember my professor then. Dr. Mary Mbewa did tell us, nursing is a calling, you're here to serve people, and these people are going to come from very diverse backgrounds. And that's really something that we have to remember. And I'm also learning as an educator right now, seeing young nurses come and go. And I mean, even though I'm not in the country, I do get to talk to some young nurses back home as well that know my story, and I get to talk to them once in a while. And you're right, they really have to have that passion for this. Work hard. I mean, it's not easy. Work hard and put their level best into it. That resilience is needed as they go through this. And
be prepared to work long hours and sacrifice some of the weekends.
Yeah. I have to say, Joyce, I just want to add one thing, is that, you have been a mentor to me when I worked in Malawi. And so I've tried to carry that, and I just encourage other nurses to be a mentor to other young nurses coming up, and to also be mentored by somebody you respect and you admire, so that we should all be, like you said, it's a hard job, and we should all be there to support each other.
Yes. Thank you. Okay, so thank you so much, Joyce. I have learned a lot from you today, and I'm sure that the scholars that are watching, they consider you their mother, so they're very excited to hear about how excited you are for them and look out for them. I'm one of them, so we do look out for you, and are very grateful for the support that you give all of the scholars that are graduated and the scholars that are in school as well. And I just wanted to check, do we have questions from the audience, Melanie, before we close out?
Let me just check here if I see any. I don't see anything in the box, but yeah, I think this was a great discussion. And let's see, actually, I'm getting a notice. Let's see, that there might be, yeah, so we did get one question. It's just popping up. Can you tell us how you build trust in the rural communities that you served?
Yeah, very interesting question. One thing is to become a rural person yourself. So what we have done when we go to the rural communities is that GAIA believes in working and solving problems with the communities themselves. So in order to gain that trust, we work with the community leaders, church leaders, and all stakeholders in that community. So we don't go to the community to educate the community or to implement activities on our own. We go there as a team. So that's how we have gained trust in the community. We respect their values, and it is them who provide solutions to whatever problems we have. So we have a lot of community engagement and feedback. We learn from them and we replan our activities and then work together. As such, the communities, I'm telling you, when you go there, it's like, we missed you. We want you to be here in our community. Yes, because we respect what they value. Thank you.
And I like that. With community work, we have to be part of the community. I mean, most of the times when we do interventions from the urban to rural, and you bring in all of these ideas that don't work for people. But I really like what you're doing is to come into those communities, get community partners, ask them what they need for their people, and then you work with that. And that's respecting their culture, respecting their values, and making them feel heard with what they're doing, which is something that I also do with my work, and I'm excited about that. Hi. I guess that's all for today. I really want to thank you, Joyce, for having this chat with us. As I've said, we've really learned a lot from you today, and I'll definitely continue to learn a lot from you off the cameras as we continue to support healthcare system in Malawi. Just want to thank Melanie for always taking the lead in organizing all of this. Thank you for putting so much work in the planning process. I'm very, very grateful for all of that. And thank you for the audience that joined us today, and hope that you will join us again in a month when we come back with our next guest. Thank you.